Pelvic floor health, why it matters and how to improve it. The pelvic floor is a remarkable, yet often overlooked, group of muscles and tissues at the base of your pelvis. It's the silent hero of your core, playing a crucial role in supporting your bladder, bowel, and reproductive organs. Pelvic floor issues are often associated with women, especially around pregnancy or menopause, but men experience them too, especially after prostate surgery or with aging. When these muscles weaken, the consequences can be significant. Fortunately, you can take proactive steps to strengthen these muscles and improve your overall well-being. This article will explore the common problems associated with a weak pelvic floor, the factors that contribute to this condition, and a range of practical solutions, including exercises, lifestyle changes, and when to seek professional help. Why a weak pelvic floor is a problem. When your pelvic floor muscles lose their strength, the hammock they form to support your internal organs begins to sag. This can lead to a cascade of direct and indirect problems that affect both men and women. Urinary and bowel incontinence. A common and embarrassing symptom is the involuntary leakage of urine or stool. This often happens during activities that put pressure on your abdomen, like coughing, sneezing, or laughing. For example, if you sneeze and notice a small leak, that's a key sign of pelvic floor weakness. Pelvic organ prolapse. This is when one or more of your pelvic organs drop from their normal position. In women, this can be the bladder, uterus, or rectum, and it typically causes a bulge that is felt or seen in the vagina. While it is more common in women, men can also be affected by a prolapse, typically involving the rectum, which can cause a bulge or protrusion from the anus. Both men and women may feel heaviness, discomfort, or notice a visible bulge. Sexual dysfunction. Weak pelvic floor muscles can lead to reduced sensation and discomfort during intercourse, affecting intimacy and quality of life for both men and women. Chronic pain. The pelvic floor works closely with your core muscles to stabilize your spine. When it's weak, it can contribute to chronic lower back pain that may not respond to other treatments. What can weaken your pelvic floor? The weakening of pelvic floor muscles is not always a simple issue of inactivity. It can be caused by a combination of major life events, chronic health issues, and lifestyle factors that place sustained stress on these delicate muscles and the surrounding tissues. Pregnancy and childbirth. This is one of the most common causes for women. The weight of the baby and hormonal changes during pregnancy, along with the physical strain of vaginal delivery, can stretch and damage the pelvic floor muscles. Aging and menopause. As we age, all muscles naturally lose tone and strength. In women, the decrease in estrogen during menopause can also reduce the elasticity of the pelvic floor's connective tissues. Chronic straining. Any activity that involves repeated, forceful straining can weaken the pelvic floor over time. This includes a chronic cough, often from smoking, bronchitis, or asthma, regularly lifting heavy objects, and especially, chronic constipation. The repeated effort of pushing to have a bowel movement puts significant downward pressure on the pelvic floor, stretching and fatiguing the muscles. Obesity. Carrying excess body weight puts continuous pressure on the pelvic floor muscles, which can cause them to weaken and function less effectively. Pelvic surgery. Surgical procedures can sometimes damage the nerves or tissues of the pelvic floor, leading to weakness. For women, this may include a hysterectomy. For men, prostate surgery is a common cause of pelvic floor weakness and incontinence. Certain medications. While not a direct cause for most, some medications can indirectly impact pelvic floor health by causing side effects that lead to strain. For example, some pain relievers, like opioids, antidepressants, and medications for an overactive bladder can cause chronic constipation, while drugs for high blood pressure, called ACE inhibitors, are known to cause a persistent cough. These side effects, in turn, can place added stress on the pelvic floor. How to strengthen your pelvic floor muscles. The good news is that you can strengthen these muscles, much like you would any other muscle group. Consistency and proper technique are key. 1. Kegel exercises. Kegels are the gold standard for pelvic floor strengthening. The first step is to correctly identify the muscles. Imagine you're trying to stop the flow of urine or hold back gas. Those are the muscles you need to engage. If you're unsure whether you're doing Kegels correctly, try stopping your urine midstream once. Don't make this a habit. If you can do that, you've identified the right muscles. It's important not to regularly practice Kegels during urination. This is just a one-time check. With regular practice, many people notice improvements in 4 to 6 weeks, but it may take longer depending on the severity of symptoms. Try to build your exercises into a routine, like during toothbrushing or walking. Technique: squeeze and lift the muscles of your pelvic floor without tightening your abdomen, buttocks, or thighs. Hold the contraction for a few seconds, start with 2 to 3 seconds and work your way up to 10. Then, fully relax the muscles for the same amount of time. Repeat this 10 to 15 times, aiming for 3 sets per day. Quick flicks: practice rapid, strong contractions to prepare for sudden pressures, such as a cough or sneeze. 2. Incorporate specific exercises. Beyond Kegels, several other exercises can help strengthen your pelvic floor in conjunction with other muscle groups. Bridge pose: lie on your back with your knees bent and feet flat. Lift your hips toward the ceiling, squeezing your glutes and engaging your pelvic floor. Hold for a few seconds before lowering. Squats: when done correctly, squats are an excellent way to strengthen your entire lower body. As you lower down, focus on engaging your pelvic floor muscles. Core strengthening: a strong core is essential for pelvic health. Exercises like pelvic tilts and diaphragmatic breathing, also called belly breathing, can help improve the coordination and function of your entire core system. The pelvic floor is part of a core canister, which you can think of like a soda can. The top is your diaphragm, the bottom is your pelvic floor, and the sides are your deep abdominal and back muscles. Learning to coordinate all these muscles is crucial for a healthy and strong core. 3. Beyond Kegels, tools and advanced techniques. For those who have difficulty with Kegels or need more advanced help, several tools can provide a more targeted approach. Vaginal cones or weights: these are small, weighted cones that are inserted into the vagina. The pelvic floor muscles must contract automatically to hold them in place, providing a progressive resistance workout. Biofeedback devices: these devices, often used at home, have a sensor that provides real-time feedback on your muscle contractions, similar to a video game or a report card. This helps you see if you are engaging the correct muscles and how strong the contraction is. Electrical stimulation, e-stim: in some cases, a mild electrical current is used to stimulate muscle contractions. This is often a treatment used under the guidance of a physical therapist for people who cannot voluntarily contract their muscles. The impact of exercise on your pelvic floor. Choosing the right type of exercise can significantly impact the health of your pelvic floor. Not all activities are created equal. Brisk walking: the Goldilocks zone of exercise. For most people, brisk walking is an excellent way to support the pelvic floor. It's the perfect balance between being effective and low risk. Low impact: it provides a weight-bearing stimulus that strengthens the muscles without the jarring force of high-impact activities. Core engagement: a brisk pace with good posture naturally engages your core, which includes your pelvic floor, improving its function and endurance. Improved circulation: it boosts blood flow to the area, helping to keep the muscles healthy and resilient. To get the most out of brisk walking, focus on maintaining an upright posture and a gently engaged core. Jogging: proceed with caution. Warning: jogging's effect on the pelvic floor is more complex. It's a high-impact activity that places a significant load on the muscles. Potential to strengthen: if you have a healthy, strong, and well-coordinated pelvic floor, jogging can be a form of functional training that builds endurance. The muscles work reflexively to absorb the repetitive impact of each stride. Potential to weaken: if your pelvic floor is already weak or dysfunctional, jogging can be detrimental. The constant pressure and impact can overstretch and fatigue the muscles, worsening symptoms like incontinence or prolapse. If you want to jog, ensure you have a strong foundation first and always listen to your body. If you feel any leakage or pressure, it's a sign to stop and consult a professional. Leisurely walking: gentle, but not a strength builder. While a leisurely stroll is great for overall health and blood flow, it may not provide enough of a challenge to truly strengthen the pelvic floor muscles. The demands on the core and pelvic floor are simply too low to create a strengthening effect. Lifestyle habits for pelvic health. Beyond targeted exercises, certain daily habits are crucial for supporting your pelvic floor and preventing weakness. Diet and hydration: a high-fiber diet and adequate water intake are critical for preventing constipation, which, as we've discussed, is a major source of strain on the pelvic floor. Proper toilet habits: avoid rushing or straining to have a bowel movement. Sitting with your knees higher than your hips, using a small footstool, can help relax the pelvic floor and improve elimination, reducing the need to push forcefully. The importance of the mind-body connection. The mind-body connection is crucial for strengthening your pelvic floor because it allows you to consciously engage and coordinate these muscles during both targeted exercises and everyday activities. Without this connection, your efforts to strengthen the pelvic floor may be less effective. How to foster the mind-body connection during walking. You can actively strengthen this connection and improve your pelvic floor's function by being mindful during your walks. Synchronize with your breath: coordinate your breathing with your steps. As you inhale, allow your diaphragm and pelvic floor to naturally relax and lengthen. On the exhale, feel a gentle lift and contraction in your pelvic floor. This trains the muscles to work in harmony with your body's natural rhythms. Focus on your posture and core: walk with an upright posture, keeping your spine long and your shoulders relaxed. Consciously engage your core by gently zipping up your abdominal muscles. This subtle action provides a stable base that cues your pelvic floor to activate reflexively with each step. Engage with intention: rather than relying solely on reflexive engagement, actively think about lifting your pelvic floor with each step. This mindful practice builds a stronger neural pathway, improving your ability to control and activate the muscles both consciously and subconsciously. Vary the terrain: walking on different surfaces like grass, uneven paths, or slight inclines challenges your stability. This forces your pelvic floor and core to work harder to maintain balance, creating a more dynamic and effective workout. When to see a professional. While at-home exercises and brisk walking are a great starting point, they're not a complete solution for everyone. If you're unsure if you're performing the exercises correctly, not seeing improvement, or dealing with significant symptoms, it's time to consult a professional. Ongoing leakage or urgency. Feeling of heaviness or bulging. Pain during sex. Difficulty starting or completing a bowel movement. Little to no improvement after 6 to 8 weeks of consistent exercise. What to expect from a professional. Pelvic floor physical therapy. A specialized physical therapist can provide a personalized plan, using techniques like biofeedback to ensure you're engaging the correct muscles. Pelvic floor therapy often involves education, guided exercises, and tools like biofeedback or gentle manual techniques. It's typically done in a private, supportive setting. They are experts in diagnosing and treating pelvic floor dysfunction. Consult a healthcare provider. your doctor can rule out other medical conditions and provide a proper diagnosis. For women, a urogynecologist is a specialist in female pelvic health. For men, a urologist is the appropriate specialist for pelvic floor concerns. Your daily pelvic health plan. Building a strong pelvic floor is a marathon, not a sprint. To make progress, try to integrate these key actions into your daily routine. Kegels. Perform 3 sets of 10 to 15 Kegels daily at a convenient time, like while brushing your teeth or waiting for a bus. Posture. Be mindful of your posture throughout the day, engaging your core and standing tall to support your pelvic floor. Breathing. Practice diaphragmatic breathing, belly breathing, to improve the coordination between your diaphragm and pelvic floor. Diet and hydration. Ensure you're drinking plenty of water and eating a high-fiber diet to avoid constipation and straining. Listen to your body, pay attention to any signs of weakness or discomfort, and don't hesitate to seek professional help if symptoms persist.